Hello and welcome to episode 151 of Chairside Live. I'm Megan Strong, and as you may have already heard, my longtime co-host and friend, Dr. DeTola, has moved on to other opportunities in the dental industry. It was an amazing 15 years he was with us here at Glidewell Laboratories, and he will be truly missed. But as they say, the show must go on. Chairside Magazine will continue, and we will continue to provide you with helpful clinical tips here on Chairside Live. With that said, let me now introduce you to Dr. Abai. Dr. Abai, welcome. Why don't you tell us a little bit about your role here at the lab?
Thank you, Megan.
Yeah.
Well, I joined Glidewell about 4 years ago. My background is that I'm a prosthodontist, and I have a strong clinical research background. And when I joined Glidewell, I was actually doing clinical research with material sciences.
Okay,
eventually, I moved on to the implant department, and I was doing a lot of clinical research with implants on patients after, obviously, FDA approval and all that good stuff. And we're using a lot of that data for our studies.
Yeah. Well, we're glad to have you on board.
Oh, thank you. No, I'm really looking forward to being here and being part of Chairside Live. I think we have a lot to provide.
Yeah.
Glidewell is not just a dental laboratory, it's really an institution, and what we do here really affects the way that dentists treat patients. Nice. So I'm excited to be a part of that.
Great. And I hear you have your first case of the week with us today.
We have a very exciting case of the week. It is a product that we've been working on. It's called BruxZir NOW. And it is the first fully sintered chairside zirconia milled product, where in this case of the week, we actually have a patient that needed a crown.
Nice.
So we brought the patient in and removed an old crown, and utilizing a chairside intraoral scanner and a mill called the TS150, I was able to mill the BruxZir NOW product and deliver it to the patient.
Nice.
So why don't we go ahead and take a look at the case of the week. All right, let's go over the case of the week for this week. And we have a patient who presents with a lithium disilicate material crown, a full coverage crown with a fracture to the distal, and this is tooth number 30. So my clinical challenge is that this patient requested a crown to be placed fairly quickly on this tooth, and he wanted to be done with the treatment. What better type of case to do than having a extremely strong crown in terms of a BruxZir, and also being able to mill it chairside. So we have been developing a product called BruxZir NOW, and utilizing this chairside fully sintered zirconia restoration, I can provide this patient with an extremely strong crown that's going to last them a long time. So essentially, when the patient came in, I went ahead and provided them with some local anesthetic, and because of the nature of the lithium disilicate material here, I actually had to segment this crown several times in order to remove it. I'm sure it was cemented with a resin cement, and this is the situation immediately after removal of that crown. So what I like to do is, especially for chairside milling, I almost have to predict how the spindle of the mill is going to work, and we have to prep accordingly. So what I'd like to provide for the mill and for the digital scan is a nice chamfer margin. Usually I like my axial reduction to be about 1 millimeter depth, and then also a good occlusal reduction of about 1.5 millimeters. You have to keep in mind this is a zirconia restoration, so we don't have to go to 2 millimeters of occlusal reduction. The tooth was already prepped, so essentially I just had to clean things up. And utilizing the two-chord technique, I went ahead and placed both cords, waited a couple of minutes, and then removed the top cord, and I was able to take an intraoral scan. In this situation, I utilized the 3M True Definition scanner, and as you can see, the images are captured very quickly. I believe the scan of the tooth took me almost a minute. I spent a little longer than I usually do capturing this image, but we were able to capture it in 56 seconds, as you see here. So we have a nice image of the tooth that we prepped, and we also go ahead and impress the opposing and Abai registration. And then, utilizing this digital information with the FastScan software, it is a software that we can use to fabricate virtual crowns, and it's very intuitive. So the software basically has built into it a library of teeth that it will import based on adjacent teeth and the shape and the size of the adjacent teeth. And you also have the option as a clinician to go ahead and play around with how much tooth structure you want to add or remove, and also take a look at the mesial and distal contacts to make sure that you have enough contact area. So you get a lot of freedom with this software. There are two different versions. There's a lab version and then there's a clinician's version, and you're just looking at the clinician's version here. So once the crown is ready to be milled, I'll go ahead and press the finish button, and it will communicate directly with the chairside mill, the TS150, and in a series of a couple of steps where I have to load the program and also load the material. In this scenario, it's the BruxZir NOW fully sintered chairside zirconia. I'll go ahead and place that into the mill, and essentially with the touch of a button, it will start the mill. For this crown, it took the mill about 45 minutes to mill. The advantage here is that you don't have to go through a lot of the staining and sintering, and you don't need an additional oven. So all you would really need is the chairside mill and the intraoral scanner. So the mill creates the crown for us, and my job now is to remove the crown from the sprue and polish it, which really just takes a couple of minutes, and then it's ready to be delivered. Usually what I do is I place the crown on the tooth and without any cement, and I have my assistant take a radiograph. I want to make sure that my margins look good. I also check the margins intraorally with my Dental Explorer as well, and I'll go ahead and deliver the crown once everything looks good. So in this situation, the patient had the advantage of having the strength of a BruxZir crown, and also the efficiency and convenience of having it done chairside and not having to take an impression and sending it to the laboratory. So that's our case of the week, and I hope you enjoyed it. So if you want to read more about BruxZir NOW, please go to BruxZir.com, and there's a lot of clinical and research information on the product. And we've been working on the product development in the research and development department here at Glidewell Dental Laboratories, and I think it would really benefit from taking a look at all the literature that's online.
Well, thank you for that, Dr. Abai.
You're welcome, Megan. I'm really excited that we have a fully sintered chairside zirconia product in the BruxZir NOW. I think it's going to be a game changer.
Yeah, for sure.
Yeah.
We should take a look at the news. What do you think?
Absolutely.
All right. If you're a new dental graduate looking for work, you might want to consider heading to Florida. They need all the help they can get right now. The state is experiencing some of the most severe shortages of dentists in the country, according to the American Dental Association. There are plenty of dentists, they just aren't practicing in the rural and lower income areas of Florida. In one such county, there is just one dentist for every 3,500 people. A lot of people in these areas rely on Medicaid, which means a low profit margin for dentists, a strong deterrent for new dental grads. To fill the gap, many dentists are regularly volunteering in areas of need.
That's really interesting. You know why we have this issue?
Why?
Because many dentists can't say rural.
Right, it's hard.
Yeah.
Rural.
Yeah,
Yeah.
very difficult.
See, easy for you to say.
Yeah, and we have a lot of dentists here in California that probably be more than happy to go to Florida and treat patients.
Right, it's the Sunshine State. I mean, what did they have, like 330 days of sunshine a year?
I think we should put them on buses and send them over.
Sounds like a good plan.
Let's do it.
Okay. And then another story we have for you. I guess a Nashville, Tennessee dentist's office was nearly destroyed after a drunk driver slammed into the clinic going nearly 90 miles per hour. The father and son dentist team spent most of the day trying to assess the damage, which left a massive hole in their front lobby. The crash happened at 4 a.m. when the truck slammed into a sign, a bus stop, and 2 trees before coming to a stop inside the dental clinic. The driver stepped out of the car on his own and then passed out on the grass. He was taken to the hospital and charged with driving under the influence. Really?
I don't think I have a comment about that one.
Right. Don't drink and drive, people. And to me, it's just crazy that at 90 miles per hour, he ran into a stop sign, 2 trees. I mean, and then still had the momentum to just absolutely plow through a building.
He could have just waited a couple of hours for the dentist to come in and do some work.
Right.
Yeah.
Yeah, so I mean, this is crazy. So I'm just glad that it happened at 4 a.m. when no one was in the office and probably less people were on the road. But he got charged, and hopefully this will deter him from drinking and driving because it's not good. Never ends well.
Absolutely.
Yeah. All right, well, thank you so much, Dr. Abai, for joining us. I think today's show went really well.
I think so too.
All right. Well, on behalf of everyone here at the laboratory, my new co-host, Dr. Abai, and myself, Megan Strong, thank you for tuning in, and please come back next week for episode 152 of Chairside Live. Wow, totally awesome, cool case of the week. Time for some news. Right? Just like that. If you're looking for no wait, what? I'm not. That was dyslexic. Let's try that again. According to the a miracle. A new word.
It's a miracle.
Great. Should we take a look?
Absolutely. Let's go ahead and go to the case of the week. Was that a question?
Yeah.
Right.